to Demography Talks podcast. Today I will talk about what is the true death toll of COVID-19. It's been more than 2 years of pandemic and we are still confused and have many questions. Which wave is this? Do we need a PCR test to fly to Thailand? Can I go to the gym without a COVID pass? But there are also more global questions. How many people have died from COVID-19 since the beginning of the pandemic? Why is the number of COVID-19 deaths provided by the official statistics not accurate? What is excess mortality? What is the true death toll of the pandemic? According to the official statistics, until mid-February 2022, 5.8 million people died because of COVID-19. However, the official data are not 100% accurate. Why is that? In less developed countries, the death reporting systems may be insufficient. According to World Health Organization, 40% of the deaths remain unregistered. The certification and reporting of causes of death are lower in African countries. In some cases, people die while being infected with COVID-19, and they are never tested for it, which can be a substantial majority in places with little testing capacity. Some countries only report COVID-19 deaths in hospitals. People who die from the disease at home may not be recorded. For example, this was the case of the Netherlands early in the pandemic. Hospitals and civil registries may not process death certificates for several days or even weeks, which delays the data. We need to keep in mind that there are also indirect COVID deaths. These are the cases when people died because they couldn't get medical treatment due to the weakened healthcare system and lack of capacity in the hospitals. Also, doctors discouraged people from going to the hospitals, which may have caused an increase in fatalities from other diseases. For example, in Scotland, less screenings for cancer were performed during the first 9 months of the pandemic, and fewer patients were diagnosed with cancer than expected. 1,600 fewer people than expected were diagnosed with the 3 most common cancers during the first 9 months of the pandemic. Breast cancer diagnosis was down by 19%, bowel cancer by 25%, and lung cancer by 9%. Data also showed that cancer was not being diagnosed at the earliest stages. The Cancer Research UK in Scotland raised concerns that opportunities to diagnose cancer at an early stage were missed. A recently published paper concluded that in the USA, initial pandemic-related disruptions in breast cancer care will have a small long-term cumulative impact on breast cancer mortality. By 2030, the models project 950 breast cancer deaths related to reduced screening, 1,314 associated with delayed diagnosis of symptomatic cases, 151 associated with reduced chemotherapy use in women with hormone-positive early-stage cancer. Sensitivity analysis indicated that the breast cancer mortality impact would be approximately double if the modeled pandemic effects on screening, symptomatic diagnosis, and chemotherapy were extended for 12 months. In another publication, it was found that the disruptions due to the COVID-19 pandemic have led to substantial reductions in new cancers being diagnosed, and this could lead to an increase in mortality caused by cancer later. Compared to the annual averages in 2018 for 2019, in 2020, colonoscopies decreased by 45%, prostate biopsies by 29%, chest computed tomography scans by 10%, cystoscopies by 21%, new cancer diagnosis by 13 to 23%. These drops varied by state and continued to accumulate despite reductions in pandemic-related restrictions. Now, what is excess mortality or excess deaths? After we saw why the official COVID-19 mortality data might not be very accurate for measuring the true death toll of the pandemic, we can discuss a new measure, excess mortality or excess deaths. I have a few definitions for you. Excess mortality is the mortality above what would be expected based on the non-crisis mortality rate in the population of interest, according to the World Health Organization. Excess mortality is the gap between how many people died in a given region during a given time period, regardless of cause, and how many deaths would have been expected if a particular circumstance, such as a natural disaster or disease outbreak, had not occurred, according to The Economist. Excess mortality is a more comprehensive measure of the total impact of the pandemic on deaths than the confirmed COVID-19 death count alone. It captures not only the confirmed deaths, but also COVID-19 deaths that were not correctly diagnosed and reported, as well as deaths from other causes that are attributable to the overall crisis conditions. This is a definition according to Our World in Data. It's important to keep in mind that the pandemic may also result in fewer deaths from other causes. For example, the lockdown, mobility restrictions during the pandemic might have led to fewer deaths from road accidents. Or there might have been fewer deaths from the flu because of interventions to stop the spread of COVID-19, social distancing, masks, etc. Or because COVID-19 now causes deaths that the flu would have otherwise caused. Seasonal influenza kills an estimated 300,000–650,000 people annually worldwide. Also, COVID-19 deaths are not by default excess deaths. It is possible to have more COVID-19 deaths than excess deaths. And in fact, there are confirmed COVID-19 deaths without any excess deaths as well. This all makes clear that the two statistics, confirmed deaths due to COVID-19 and excess mortality, can be related in ways that are not straightforward. This is because they are giving a perspective on different questions. The confirmed deaths often undercount the total impact of the pandemic on deaths, but in contrast to excess mortality, they contain information about the cause of death. The excess mortality includes not only those who have died from COVID-19, but also those from all other causes and indirect causes. And these numbers may also be changing due to the overall pandemic conditions. This means both metrics are needed to understand the total impact of the pandemic on deaths. How to calculate the excess mortality? In order to calculate excess deaths, we take the number of people who die from any cause in a given region or period, we will call it reported deaths, and compare it with the deaths from the recent years. We call them expected deaths. Statistical models are used to create baselines by predicting the number of deaths each country would typically have recorded in 2020 and 2021. There is no single source with all the data on excess mortality because the data is not available for all the countries. This is due to lack of capacity and infrastructure of some statistical agencies to report the number of people that died in each month, week, or day. This detailed data is most often available for richer countries that can afford high-quality data reporting systems. But there are several models that estimate the excess deaths. In this video, I will talk about the model created by The Economist. The Economist used a machine learning model to identify 121 indicators and produced estimates for over 200 distinct countries and territories. In cases where data was unavailable, weighted averages were calculated from neighboring or similar countries for each missing variable. Some of the indicators used are the scale of COVID-19 testing, results of antibody surveys, the degree of internet censorship, the number of years a country has been a democracy, etc. It is possible to examine the importance of each indicator in the model, but this is far from straightforward. Features can act in combination and their relative importance might differ for countries with different characteristics. To strike a balance between information obtained from big countries and small ones, The Economist weighted data for each country by the logarithm of its population. This meant that the eventual model would assign more importance to Mexico than Monaco, without entirely ignoring the latter. The main sources of data are Human Mortality Database, which is a collaboration between University of California, Berkeley and the Max Planck Institute in Germany. The short-term mortality fluctuations data series is the first international database providing open access, harmonized, uniform, and fully documented data on weekly all-cause mortality. It includes 38 countries because it includes only the countries where death registration and census data are virtually complete. Therefore, all the countries included in this list are developed and relatively wealthy. Another source is World Mortality Dataset, created by Ariel Karlinsky and Dmitry Kobak. It started in January 2021. The authors have updated the database regularly with all-cause mortality before and during the pandemic, starting with the year 2015. The database includes data for 117 countries and territories. Data is collected weekly, monthly, or quarterly. It is considered one of the most comprehensive databases with excess mortality estimates. The official number of COVID-19 deaths on 16th of February 2022 was 5.8 million. According to The Economist, there is a 90% chance that the true value lies between 14.2 million and 23.2 million additional deaths. I will present now the countries with the most excess deaths per 100,000 people. Bulgaria has one of the highest national excess mortality in the world. Bulgaria also suffered from a second wave of deaths in November and December 2020, but then another wave in spring of 2021, with one more in autumn and winter 2021. Bulgaria was also slow to vaccinate its citizens. Serbia followed a similar path to Bulgaria with a deadly outbreak in November and December 2020. Same about North Macedonia, it follows a similar pattern as Bulgaria and Serbia. Among the former Soviet states, Russia was one of the most affected by the second wave in autumn-winter of 2020, but also recorded the most deaths than expected. Lithuania is the second former Soviet republic that recorded most excess deaths, being hit the most during November and December 2020. The most countries in Latin America experienced a devastating first wave from April until July 2020. The second wave started at the end of 2020, beginning of 2021. Peru reported higher peaks of excess mortality compared to the previous wave. In April and May 2021, Peru suffered the worst death tolls. There are also exceptions, countries that recorded deficit of deaths or very low excess mortality. Australia and New Zealand managed to eradicate local transmission after severe lockdowns, and this led to a drop in deaths from influenza. Iceland and Norway and other countries in Northern Europe have experienced much lower mortality rates throughout the pandemic. Some Nordic nations have experienced almost no excess deaths at all. The exception is Sweden, which imposed some of the continent's least restrictive social distancing measures during the first wave. Taiwan achieved the same outcome through highly effective contact tracing systems. There are some limitations of this measure. Calculating excess deaths for the entire world is complex and imprecise. There is no single source of data on excess mortality, and no data source will have data for all countries because excess mortality statistics will only be available for a minority of countries. Outside of Europe and the Americas, few places release data about excess deaths. No such information exists for a majority of countries in Africa and Asia, where some countries only issue death certificates for a small fraction of people. Excess mortality statistics is only available for a minority of countries, as already mentioned. Therefore, statistical models are applied and are needed. There are a few solutions for better estimates. More institutions are working on elaborating models and improving estimates, for example, World Health Organization or health metrics and evaluation. One way of improving the estimates is extrapolating from smaller regions where data might be available. Another method is to survey a representative sample of households and ask them about deaths. Mervat Al-Khafar, a public health researcher at the London School of Hygiene and Tropical Medicine, worked on a study that used an even more direct method to estimate deaths: counting graves. Using satellite images of 11 cemeteries in Aden province in Yemen, the study suggested that weekly burials increased by up to 230% between April and September 2020. Al-Khafar says the technique is useful but can't be applied everywhere. You need to engage with the locals on the ground to understand the burial practices and make sense of the images. It can be hard to establish such connections because people in conflict zones often fear the reaction of local authorities. The biggest lesson of the pandemic is that the world is in demand for real-time mortality data, and not only. Many countries don't collect good data on births, deaths, and other vital statistics. For now, the true death toll of COVID-19 pandemic can still be disputed. Thank you very much for your attention, and see you soon. If you like this video, please subscribe.